Andre Garcia, and the topic that we will review today is closed loop control in type 1 diabetes. So, type 1 diabetes mellitus is one of the most common chronic disease in childhood. It's caused by insulin deficiency following destruction of the insulin producing pancreatic beta cells. It most commonly presents in childhood, but one fourth of cases are diagnosed in adults. Type 1 diabetes remains the most common form of diabetes in childhood, despite the increasing rate of type 2 diabetes mellitus. The incidence of childhood varies based upon geography, age, sex, family history, and ethnicity. So, the highest reported incidence of type 1 diabetes mellitus occur in Finland and Sardinia, 37 to 65 per 100,000 children younger than the age of 15 years. In the United States, the annual incidence of type 1 in children and adolescents is 22 per 100,000 overall. The age of presentation of childhood onset has a bimodal distribution, one peak at 4 to 6 years of age and the second in early puberty. Overall, approximately 45% of children presents before 10 years of age. Type 1 diabetes accounts for almost all cases of diabetes before 10 years of age, 90% of cases in children from 10 to 14 years, and 80% in youth, 15 to 19 years. And type 1 diabetes mellitus occurs more frequently in males.
Risk factors. Both genetic and environmental factors contribute to the risk of developing type 1 diabetes. The lifetime risk of developing type 1 is significantly increased in close relatives of a patient with type 1 diabetes. No family history, 0.4%. Offspring of an affected mother, 1 to 4%. Offspring of an affected father, 3 to 8%. Offspring with both parents affected reported as high as 30%. Non-twin sibling of affected patient 3 to 6% by age of 20 years and 10% by age of 60 years. Dizygotic twin 8%. Monozygotic twin 30% within 10 years of diagnosis of the first twin and 65% concordance by the age of 60 years. On the other hand, exposure to one or more environmental agents, for example, viruses or foods, appears to trigger an immune response that ultimately cause destruction of the insulin producing pancreatic beta cells.
About 10% of people with diabetes have type 1. It's got nothing to do with diet or lifestyle, it just happens. When you have type 1 diabetes, your body attacks the insulin-producing cells in your pancreas, so you can't produce any insulin at all. And we all need insulin to live. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our bodies. When you have type 1 diabetes, your body still breaks down the carbohydrate from food and drink and turns it into glucose. But when the glucose enters your bloodstream, there's no insulin to allow it into your body's cells. More and more glucose then builds up in your bloodstream. So what does this mean? Well, before diagnosis, your body tries to get rid of the glucose through your kidneys, and that makes you wee a lot. Weeing so much leads to another symptom of diabetes, extreme thirst. Because glucose can't enter your cells to give you energy, you'll feel incredibly tired. To try and get energy, the body breaks down fat stores to provide fuel. That's why people often lose weight before discovering they've got type 1 diabetes. These symptoms tend to come on quickly, over just a few days or weeks. Anyone who has these symptoms should see a doctor as soon as possible. If you've got type 1 diabetes, you get insulin into your body by injecting it or using a pump which delivers a constant supply into you. You'll also need to check that your blood glucose levels are not too low or too high by using a blood glucose testing device several times a day. When you start taking insulin, you'll begin to feel better, and your blood glucose levels will go down. This is important because over a long period of time, high glucose levels in your blood can seriously damage your heart, your eyes, your feet, and your kidneys. These are known as the complications of diabetes. But with the right treatment and care, the long-term effects of diabetes and high glucose levels can be managed. You can find out how we can help you manage your diabetes on our website. We're still not sure why some people get type 1 diabetes and others don't, or why the immune system of someone with type 1 attacks the cells that produce insulin. But our researchers are learning more and more about type 1 diabetes, so we can develop new treatments and one day find a cure.
Application in medicine. Closed-loop system combine a continuous glucose monitor and an insulin pump to regulate a user insulin. This system is connected with blood glucose sensor and insulin pumps to automatically increase, decrease, or stop the delivery of insulin in response to the glucose levels of people with type 1 diabetes.
Management of type 1 diabetes can be difficult in very young children. Sensor-augmented insulin pump therapy has been associated with improvements in glycemic control, but management remains challenging. Hybrid closed-loop systems, in which an algorithm automatically adjusts basal insulin delivery, have shown promise in older children and adolescents, but data in young children are limited. In this multicenter randomized crossover trial, 74 children 1 to 7 years of age with type 1 diabetes received 16 weeks of hybrid closed-loop insulin therapy using a proprietary algorithm, followed by 16 weeks of sensor-augmented pump therapy, or vice versa. The primary outcome was the percentage of time in the target glucose range, defined as 70 to 180 milligrams per deciliter during each study period. The percentage of time in the target range was 72% during the closed-loop period, significantly greater than the 63% during the sensor-augmented pump period. Among other key outcomes, time with hyperglycemia was less during the closed-loop period. Time with hypoglycemia was similar during the two interventions. Both mean glycated hemoglobin level and mean sensor glucose level were lower during the closed-loop period. The incidence of adverse events was also similar. One severe hypoglycemic event occurred during the closed-loop period, and one non-treatment-related serious adverse event occurred during the sensor-augmented pump period. No episodes of diabetic ketoacidosis occurred. The authors conclude that in very young children with type 1 diabetes, hybrid closed-loop insulin delivery led to improved glycemic control as compared with sensor-augmented pump therapy, with no increase in hypoglycemia. Full trial results are available at nejm.org.
Pros. The closed-loop system used for 6 months led to greater glucose levels in target range, less hyperglycemia and hypoglycemia, better glycated hemoglobin levels. Cons. In this study, a total of 17 adverse events were reported, and there were high reports of diabetic ketoacidosis, which is a serious complication of diabetes that can be life-threatening. Issues applied in Ecuador. Unfortunately, in Ecuador, there are no outcomes reports of closed-loop treatment, probably because of its high cost. And this could represent another disadvantage for my consideration, because there is evidence that says that in Ecuador, diabetes caused 5,064 deaths in 2015, ranking as the second cause of general mortality, the first cause of death in women, and the third in men. The National Health and Nutrition Survey, carried out in 2012, reported a prevalence of diabetes of 2.7% in Ecuador for the age groups between 10 and 60 years, which increases progressively, and it is estimated that 1 in 10 Ecuadorians suffers from diabetes. Conclusions. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly destroys cells in the pancreas that produce insulin. This leads to insufficient insulin production and lifelong dependency on exogenous insulin administration. That's why it is really important for Ecuador to start studies program where this patient can choose to have closed loop control and to see possible benefits for them.